Hi guys, we're doing a few practice scenarios this morning. We had a few difficulties with some embarrassed patient scenarios. How to build a rapport when the patient clearly is struggling and doesn't want to be there talking about whatever problem they've come to see you about. So 3 quick tips to think about that can help in this situation. Number 1, thank the patient for coming. If you get a scenario and someone comes in, they clearly don't want to be there, thank them for coming. There's sometimes nothing more powerful than showing appreciation for them taking their time to come and talk to you about their problem. Mr. X, gosh, I can see this has been a really difficult time. Something clearly really difficult to talk about. I just want to thank you for taking the time to come and talk to us about this. I really appreciate it. I know it's difficult. Straight away there can be that comfort level opened up. It can build rapport. It can show that the doctor really is interested in what that person's come to see, and they're not just another patient on the line in their clinic. So thanking them can be quite powerful. Number 2, make this situation as normalized as possible. Mrs. X, gosh, I know this is a really difficult thing to talk about. You probably haven't talked about it to anyone before, but I just want to let you know we talk about these things all the time as doctors. We see patients just like you in the same situation, pretty much day in, day out. So I just want to reassure you that this is not something unusual for us, and I want to try and help you as much as we can. Sometimes normalizing it, reassuring that we see these things often can help to build that rapport and open that patient up to you. And thirdly, think about offering relevant alternatives. So for example, if you're seeing a female patient, you're a male doctor, and they're clearly struggling, you can see that they're finding it difficult to talk to about certain things, offer to book them in with a female doctor, for example. If they're a patient who's seen another doctor in the past and opened up about this problem, offer to book them back with that other doctor. Again, it just shows that you're open enough to pick up on the cues that they're struggling and look for alternatives that may make life a little bit easier for them. Of course, in a medical exam situation, they're unlikely to accept that offer, but it just shows your global thinking, and it shows your ability to pick up on cues and make the situation as comfortable for them as possible. So 3 things to think about in an embarrassed patient situation in a medical exam. Number 1, think about thanking them for coming. Number 2, think about normalizing the situation as much as you can. And number 3, think about offering relevant alternatives where appropriate. We've got a much longer video on embarrassed patients and how to deal with them in exams. So have a look at that video if you found this one of use. Otherwise, hashtag can pass, will pass, hashtag I went with Arora.